Good afternoon, and thank you for joining our weekly COVID-19 briefing. As always, we're joined by Acting Health Commissioner, Dr. Cheryl Bedigal. Today's briefing is being live streamed on the Health Department's YouTube channel and will be available for future viewings there. Today's briefing will run until 2:30. Usually, we present remarks in Spanish, but Deli is feeling under the weather today, so we won't have live translation. As soon as she's back on her game, we'll record Dr. Bedigal's remarks in Spanish and post that to our YouTube channel. With that out of the way, Dr. Bedigal, would you please start us off?
Sure. So good afternoon, everyone, and welcome to our weekly briefing. We'll start off this afternoon with an update to our numbers. First, since last week, 1,271 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 236 new cases per day, which is the lowest we've seen since mid-September. This wave is far from over, but things are trending in a good direction. About 3% of test results we're receiving are positive, which is about where we've been since late September. And no big round numbers to report this week, but more than 86% of Philadelphia adults have received at least one dose of vaccine. More than 70% are fully vaccinated. And 80% of Philadelphians aged 12 and up have gotten at least one dose of COVID vaccine. More than 65% of this eligible group is now fully vaccinated. The number of Philadelphians who've received a booster dose continues to jump up. This week, I can report that more than 24,000 Philadelphians have received a third dose in total, about 8,000 more than last week. And since we're talking about booster doses, I wanted to talk for a minute about who should get a booster dose, what that looks like on the ground here in Philly, and what's next. So first, remember, anyone who got their second dose of Pfizer vaccine more than 6 months ago and is a resident in a long-term care setting or is higher risk because of their age, any medical conditions they might have, or the type of job that they have, should seriously consider getting a booster dose. Booster doses are available today anywhere they have Pfizer vaccine. Check vaccines.gov for locations. And there is plenty of vaccine available now. Finally, later this week, the FDA will begin meeting to see about recommending booster doses for people who originally got Moderna or Johnson & Johnson. If you remember from before, the FDA has external experts who discuss the vaccine first and then considers their recommendation and makes an official FDA ruling. After the FDA rules, the CDC's panel of external experts reviews the science, and then the CDC will make an official recommendation. Once that happens, we would be able to administer booster doses of Moderna and J&J vaccine here in Philadelphia. It's not just a question of whether or not Moderna or Johnson & Johnson can be approved for booster doses. The experts are also looking at who would benefit from a booster dose, at data on the most effective timing, and at the impact of getting a different vaccine from the one you got the first time. In other words, mixing and matching. While booster doses are important, they're not nearly as important as making sure that everyone who hasn't yet been vaccinated gets their shots. And Philadelphia has an important deadline coming up on Friday. All hospital and long-term care facility staff and student staff and faculty at higher education institutions need to have their first dose or an exemption by this Friday. The vast majority of people in these settings have been vaccinated, so thank you to each and every one of you. You know that getting vaccinated isn't about making a deadline, it's about saving the lives of the people around you. In high-risk healthcare settings, like hospitals and nursing homes, it really can be a matter of life or death. And given that in these settings, a healthcare worker's most important job is to keep people alive, being vaccinated during a pandemic is the lowest bar to clear. I've said it before, if you're not willing to do what it takes to protect patients, maybe healthcare isn't the job for you. I am confident that with 2 full days remaining before the deadline, and after nearly 2 months of having this mandate in place, those who are really dedicated to protecting those around them will find a clinic or a pharmacy and will get vaccinated. As we've seen at every step during this pandemic, Philadelphians have stepped up and done what needs to be done. That's why I'm confident we'll continue to see our healthcare workers and folks in higher education get vaccinated ahead of the deadline. I've been asked to allow for another extension for this mandate. But at some point, we have to take a firm stance and say that protecting the lives of people who are most vulnerable is of paramount importance. Furthermore, we're not the only people with an upcoming mandate. The federal government is expected to publish detailed rules on a vaccine mandate later this month that will apply to all healthcare settings that receive Medicaid and Medicare funds and will be effective immediately. According to President Biden's announcement, there will be no testing option for healthcare workers. They will be required to be vaccinated. Delaying our mandate won't change the fact that people still need to be vaccinated. It will just further expose vulnerable people to a killer virus needlessly. With more than 1,200 deaths in Philadelphia long-term care facilities due to COVID-19, more than 1/3 of deaths due to this pandemic in our city, this cannot be optional. Get vaccinated today. Save a life, be a hero. There are plenty of vaccine clinics and pharmacies with vaccine just waiting for you. Visit phila.gov/vaccine or vaccines.gov to find the closest. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Thank you.
Thank you very much, Dr. Bedegal. For folks who joined us late, just to let you know, Zelly is feeling under the weather today, so we don't have live translation into Spanish today. We'll record Dr. Bedegal's remarks and post them on our YouTube channel later. We'll now move to Q&A. As usual, we ask that reporters limit their questions to 2 or fewer, but we've got some time, so we'll take extras, and stick with the topic at hand. If there are any reporters who do not get a chance to ask a question or think of something later, please don't hesitate to reach out via email and we'll get back to you. For anyone who would like to ask a question, please raise your hand. First up, I see Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedegal, I'm wondering, particularly with the nursing homes and the vaccine mandate, is the city prepared for, a scenario in which it might result in a lot of workers being terminated and nursing homes being shorthanded? And, how would you help them respond to that?
Yeah, so I will tell you to start with that most workers, more than 85% of workers in Philadelphia area long-term care facilities have had at least 1 dose of vaccine. So, while there are a few nursing homes with very low vaccination rates, most of them are almost there, and they do have several more days to get the rest of their folks there. So we are not anticipating widespread worker shortages. I will say that there are a few places that, we have concerns about that have low vaccination rates. But, the more important thing at this point is that we just can't continue to put people at risk. And every time we look at those statistics, we're looking at statistics from nursing homes twice a week now, and we see a continued stream of cases of COVID among residents, among staff. People in nursing homes are not going out and bringing COVID back themselves. It's being brought in by staff at those sites. And most of the time, those are unvaccinated staff. So, we know from watching this happen in New York, at the University of Pennsylvania, at other sites, that mandates are effective. But, we do need people to get vaccinated. So not anticipating widespread worker shortages. The other thing, though, that I think it's really important that we all realize is that these are settings with extremely high turnover rates at baseline, not related to vaccines at all. But, these are very low paying frontline jobs, often $11 or $12 an hour. People, when they're not making a living wage, are often continuously looking for other jobs. So the turnover is very high. Vacancy rates and positions are very high at baseline. A little bit of this is the concern is about vaccine mandates. A much bigger piece is about how we value this kind of frontline healthcare work.
Okay, and how many nursing homes, can you quantify like how many you've heard from that have, huge concerns about being able to meet this deadline?
We haven't, generally speaking, heard from individual nursing homes. We've heard from associations, and the associations expressing concern on behalf of nursing homes at large, but not so much from individual facilities.
Okay, thank you.
Thank you very much, Laura. Next up, we'll go to Stephanie Stahl from CBS 3. Go ahead, Stephanie. You should be able to unmute.
Hi, Dr. Benegal. Thanks for taking the question today. We talked to the Pennsylvania Healthcare Association. They say they have 2,400 people, 30% of their workforce that might not meet this deadline. They say it's going to be a crisis and that the city needs to come up with some kind of a plan to address this, that, you know, you're going to have people in nursing homes who don't have people to take care of them. What's your reaction to what they say? And are you going to come up with some sort of a plan?
So the numbers they're citing don't fit with what's been publicly reported. So I will say that staff vaccination rates are publicly reported data. So you can look at that data yourself, but that's not what we're seeing. It may be that that's older data. But there are significant numbers of staff at these sites that are unvaccinated. There's time. So we would really strongly recommend that they do a major push to get their staff vaccinated. What they do after the 15th, they are not required to terminate people. They simply can't have them work. So they could carry people on unpaid leave and give them a certain amount of time to get vaccinated. That probably would be a reasonable approach. But it's not an option to continue to have these unvaccinated staff members coming into these facilities with vulnerable seniors who are at risk. So, this is really a moment for people to pay attention and to get those vaccines. Regardless of Philadelphia's mandate, this is coming. The federal mandate, and I think there's been some confusion between the mandate for businesses with 100 or more staff and the mandate for healthcare workers. But the federal mandate for healthcare workers does not allow exceptions for people who don't want to get vaccinated to get tested. They're required to get tested, and that's for any institution that takes Medicaid or Medicare.
Is there, just to follow up, so is there going to be a backup plan if people don't follow your advice and get vaccinated? If we have a large number of people not at work taking care of people in nursing homes, do you have a plan for how those people will be cared for?
So we would expect the nursing homes to staff and to meet the requirements. There are a few nursing homes that have very low vaccination rates. This is something people should pay attention to, by the way. If you have a loved one in a nursing home, you want to know what their vaccination rate is. If it's 55%, that's a real problem. There are a lot of nursing homes in the area that are either at 100% or very, very close to 100% at this point. But, there's also in Philadelphia quite a few empty beds in nursing homes. So, in a dire emergency, there are ways to handle that if we had to do that. I'm not anticipating that. People really do step up with these mandates. They do what they have to do. But this is important. And I think ultimately what we're looking at is, it's likely that cases will surge as we get into the colder weather, late fall and the winter. We want to make sure that we don't see ever again what we saw in our nursing homes in the earlier stages of the pandemic. It's completely preventable. But 1 out of 3 deaths in Philadelphia, and I believe this is true across the country, 1 out of 3 deaths from COVID occurred in our nursing homes.
Thank you for your time.
Thank you very much, Stephanie. Last call for questions. If anyone has a question, please raise your hand. All right. Not seeing any further questions, I will conclude today's press briefing. Oh, my apologies, Laura. Looks like you got one in just under the gun. Laura McChrystal from the Inquirer.
Hi, just one more, Dr. Bedical. You just mentioned that, we don't know what the fall and winter will look like. I'm wondering if you could expand on that. Are you expecting that we'll see cases rise again as it gets colder here? And what, I guess, what could we expect to see? And is there the potential as well for more restrictions?
So I've said before that I've given up predicting the future with this pandemic. We don't know, but certainly it's, when people tend to gather indoors, we're looking at cold weather coming, we're looking at Thanksgiving, we're looking at Christmas and New Year's, lots of potential for people to gather, including people who are unvaccinated. And if that happens, we may see a significant rise in cases. What happens in especially our long-term care facilities, is that cases in those facilities depend on 2 things. They depend on the vaccination rates of staff, and they depend on the level of circulating virus in the community. People who work in these facilities live in the community. If they're going home to neighborhoods that have a lot of COVID circulating, they will bring it into the facilities. So, I can't tell you what the case rates are going to do in November and December and January, but I can tell you that we know how to prevent them from going up, and we know how to prevent deaths and hospitalizations from this virus now. And that's what we're trying to do.
Okay, thanks.
Thank you very much, Laura. And with that, we will conclude today's press briefing. Thank you very much for coming, and we will announce next week's briefing via media advisory when we have a time and date set.